All right, we're live, guys. All right, this is
Right.
cool.
Okay.
All right, Haitian Times community. Hi, my name is Sherelle Angerville, or en Creole, Shirelle Angeville. And I am the social media manager for the Haitian Times, and I have the absolute awesome privilege of moderating this discussion on COVID-19 or coronavirus, virus corona, and the Haitian community. I am joined by some extreme, exceptional women in our Haitian community. I'll briefly introduce you to each of them, starting with Dr. Magdala Chery. I'll read you their bios. Dr. Magdala Shelley is a doctor, speaker, educator. She serves as a primary care general internist, and she is an assistant professor at Rowan Medicine in New Jersey. In her spare time, she loves to mentor students and serve in her local community. Next up, we have Marline D. Edmond. She is a first generation Haitian American professional raised in Elizabeth, New Jersey. She holds a Bachelor of Science in Health Education with a concentration in public health from Montclair State University, excuse me. She became a certified health education specialist in 2015. She then received her master's in communication and information studies in health communication from Rutgers University. She is an active part of her community. Many know her. She is the chairwoman of the Haitian Flag Day Planning Committee in New Jersey. She's raising cultural, educational, and civic awareness throughout New Jersey Haitian communities. Last but not least, we have Marline, another one, Marline Francois-Madden, and she is the owner of Hearts Empowerment Counseling Center. She is a Huffington Post contributor, a public speaker, entrepreneur, author of a #1 best-selling book on Amazon, The State of Black Girls.
Hey.
She comes with 13 years of clinical experience. She is a sought-after expert in mental health, trauma, self-care, and girls leadership. Thank you all for joining us today. Thank you all for agreeing to do this live so quickly to inform the Haitian community about what is going on today, what's going on right now. We can start off with Dr. Magdala Chery. I mean, the main question, what exactly is COVID-19? What is this coronavirus? If you could explain it in a way that we can understand.
All right. So let's get there. But I think before we start, just to break the ice, I see some people in the chat. So please engage with us, ask us questions, leave comments. So we can really get to know what you guys want to hear. And I think to break the ice, ladies, if you don't mind, share some of the funniest things you've heard in regards to the coronavirus or virus corona from other people, because I think it'll help to break the ice and help people to see that we're all in the same boat and we're in this together. What have you guys heard from your parents, from church leaders? Like, share any funny tips. Anybody who's in the chat, please drop your comments so we can hear what you guys have heard as well. Anybody? Yo, if I see one more story of
Zoyon is in every household, right?
Like,
you know, all you people don't speak Creole.
So, just to let our listeners know, we're gonna mix it up a bit. Faut nous parler anti-créole, faut nous parler anglais, vous comprenez?
Absolutely.
Nous pas connaître qui est captande, but it's important pour nous, for us to speak our native tongue and for everyone to understand what is taking place right now. But back to the Zoyon. I remember, I find it very funny parce que longtemps les monter kon gen rime, right? Runny noses. I used to say, hey, cut an onion in half and put it by your bedside. And everyone looked at me like I was crazy. And I'm like, well, if you think about it, when you're cutting an onion, your tear ducts naturally just,
watery and everything, right?
So in my mind, it's the same concept when you have a runny nose. Kunya, mbakone kieski lage on video. I don't know if it was 9 or Ash Kunya shot one with no affaison. So that was one funny thing.
The Jiwa.
The Jiwa?
The Jiwa is another one I'm seeing. I don't know about the Jiwa, but the Citron, like tout bagay. Everybody's taking a lemon, squeezing it on everything before you touch anything.
Okay.
Lemon. So my father was the one who was like, like put it all over your apartment and everywhere. So that's the one that I've been hearing.
So instead of using Lysol or something like that, just mettez
Use a
citron.
lemon.
Okay.
Told to use a lemon. Yeah.
Okay. And then the jus off. I know the jus off, and like there's like a
concoction.
looking concoction.
I'm getting to that.
Yeah.
I did it.
You made it?
Yes, I made it. And what's funny is that a Haitian person, they had a TikTok video with their mom, and the mom created it and kept saying how this is going to kill the coronavirus. And we know in the Haitian community, a lot of adults, like older the gamun, they're into these natural holistic medicines. So I was like, I'm going to give this a shot. So I created it, put it in my fridge, and it tastes pretty good. And I remember, I remember when I posted it, a lot of other people was like, "Oh yeah, my mom was about to send me a batch of that too. My grandma sent me a batch of that." And I'm like, "Wow, people really are into this, like honey with jus off and garlic."
They are
like the Scotch bonnet pepper,
yes,
pepper.
Yes.
So we're gonna get into that a little bit more.
So now that we have an idea of what people are doing, let's make sure the purpose of this is to make sure our community is informed. We understand that historically we have not been comfortable. We always think, they're just pushing a pill and not allowing us to be comfortable because they don't know our culture. They don't understand us, which is why I wanted us to start off that way, because we may laugh about it, but it's something no matter where you come from in Haiti, where you live in the States, we can all relate to. So bringing it back to why we wanted to make this session here today all together is to talk about what's happening, because we've heard about the coronavirus, people are talking about it, but what does it mean? So before we get into that, I like to take a step back and talk about the immune system so people understand how we operate. So typically we see germs, bacteria, viruses all the time throughout the whole day. Our body experiences those, but our bodies are so intelligent where it sees a virus, it sees a bacteria, it says, I don't like this environment. And your immune system will kick into work even when you don't feel sick. Even when you don't even realize what's happening, your immune system says, hold on, this is not supposed to be here. I don't like what it's doing. So let me fight it. So there's sometimes we say, my son's on my legs right now. I don't feel so good this morning, or I don't know, I feel a little tired. Maybe I feel a little warm. What's really happening is you could easily have been catching a virus or a bacteria, and your body's like, let me take care of this. Let me fight it. You don't even know. 2 days later, you're like, I feel better. I don't know what that was. I feel good. And really, your immune system was able to say, hey, I don't like this. It's not supposed to be here. I'm going to use the right cells and build up my immunity to fight this off. And when your body does that, it says, okay, take a picture of it. Take a memory of this virus. So when you see it again, how to fight it.
Okay.
So that's why a lot of times, once you get sick once, you don't get sick again. And it doesn't happen anymore. So that's what's happening within your own body to remind you. And this is important. So that's why, typically a healthy person is not always getting sick. Like I said, you don't even know when you're getting sick. Now, why is this key? The coronavirus is a virus that we are not familiar with. Our bodies have not seen it. It does come from China. It's a different strand from other viruses we've seen. So our body has not had a chance to say, hey, I saw this before. I don't like it. I have to protect myself. When your body is not familiar with something, your immune system jumps into overdrive, even more so to try to fight it. And that's where it brings us today. Because of that, different people have different responses to this virus. And I know people say, I get often, it's just a virus. Why should I care? No, it does matter. I know we're used to when you go to the doctor, virus is going to go by itself. This is very different. This virus is very smart and it's operating very differently from what we've seen. And as you guys are seeing in the news, you're learning information as the doctors like myself are learning information. What we thought would work does not work because it's working very differently. So we've had to look at what's happening in China because it started there first. Look at what happened in Europe because it was also because of where the geographics are, where the countries are. It was happening in Italy and France and Germany and all these other countries. And then before it came here, we've been watching to see what's been happening so we can know how to respond to this. But in short, it's a virus that we have not been familiar with. There are there's suggestions that there's different strands,
Okay.
which may explain why someone gets sicker than another person.
Okay.
And we're still learning the process of all of that.
Okay. What's the incubation period, or what's the symptoms? Because we're hearing, it's a fever, it's a cough, it's like it's almost like the flu kind of, but it's not
Right.
the flu. We are in flu season, we are in
Right.
allergy season, so a lot of people we nous pas connaît qui ça lié. So ou ka gon grippe and then yo do say, COVID-19 is corona. Ou bien
Right.
ou pas say like ou get corona, but it just allergies you again. So,
Right.
what's the difference?
Great question. So let me backtrack for that before we answer it. So a lot of people want to know, when did this come up? Was it here? Like, did it just get here in the last 2 weeks? It did not just get to the United States in the last 2 weeks. We are hypothesizing that it's been here since the fall. Wow. It's been here since October, November. But we didn't know that. We thought, exactly like you said, it's like the flu.
Yeah.
Because, you have fevers, you have coughs, like your throat hurts, and then well, you're fine. Very few people were ending up in the hospital, and we weren't on alert to know to check it. So this is key, because the reason why this is key is, even though this was happening, we were spreading it. And that is what we're not understanding. Okay. And I'm going to bring it home a little bit more for people, because a lot of the people in our community work as taxi drivers, work as bus drivers, work in factories, work in nursing homes and hospitals. So if you want to think of it in that terms, we didn't know who had it, because some people had it and had no symptoms. Some people had it and low symptoms and thought, oh yeah, I'll get better. I'll miss a day of work and I'll come back. So a lot of people may say, oh, like, why would it confine me? Or where did it come from? When really we have to understand that when we're in tight corners with people, we're spreading it. So we know it's a virus. We know our body has not seen it. We're learning now that we spread it through, as we're talking, the respiratory droplets, like the things that come out of your mouth that are very small, you can't even see. That's how you spread it. Okay. We're also learning that it stays on the surface. Lié to table, lié to cardboard, lié to boîte, lié to plastic, things like that. And you're even saying lié to rad. The reason why we don't know for sure is you'll put tester ça. Okay. So there is a possibility it can actually stay on clothes. Okay. So you can have one person qui la grave à l'hôpital, again, il pas même connaître again, because they had no symptoms at all, they had no fever, they're fine. You can have a next person who got it somewhere else, and you're going to fièvre, they have a fever, they're sore throat, they're coughing, you're going to bon quantité, let me get some citron, some soya, it'll go away, which is fine, because if you're healthy, you're expecting that. The problem with that is you don't realize you're spreading it. So now, même si ou fin, you're fin recover, ou fin bon, a few days, you have no problem. What you didn't realize is everybody you talk to, like you spread it to everybody else. Okay. And that's where we're really talking about a problem. So I really want to emphasize that, because yes, moun qui veulent malade, yo pas ka respirer, y a tousser, their fevers are 103. It's really bad, but that's such a small percentage. It's really a lot of people like us who can say, they don't see fièvre, I had a cough, but you don't realize, l'autre à l'église, ou al bay tout moun l'église la qui te parle avant. L'autre à travail, ou bay tout moun travail. Si t'es point boss, ou bay tout moun nan boss la. Si t'es à la market, ou bay tout moun nan market la. So this is really key for us to understand that we spread it to each other, and the days last. So to give you a rough estimate, they say that if somebody gave it to you, it takes about 5 days for you to start to see symptoms, if you're going to see it, up to 5 to 7 days. Okay. And they're saying they believe if you were to experience, somebody gave you the virus and you have no symptoms, but you've been in contact, 14 days is the safe window. Okay. But I will tell you that I just read something today that said the safe window is really like 21 days. It's actually a lot longer. And I've also read that if you have symptoms, your window is even further out more. Wow. So I know you hear 5 days, 7 days, 14 days. If I can make this very easy for you, I'm going to say this. If you, who has the virus, use the number 14. Allow yourself not to interact with other people and kind of stay to yourself for 14 days.
Okay.
Sou konnen ou te rencontre un moun ki gen, and now ou gen fièvre, ou gen tous, mais you're okay. You can breathe. You can stay at home. You can kind of get yourself better. I would actually say longer than 14 days. I would actually say you're looking at closer to 21 days, even almost up to 25, 30 days, depending on how bad your symptoms are.
Okay. So we have a couple of questions that are coming in, but I'm going to save those and come back to them a little bit later because we might answer them in the remaining questions. So we want to talk about the high-risk group of people. I think you briefly touched on it a little bit. Who are the high-risk people? Like we know, especially for our community, we have a lot of moun qui get fait tension, moun qui fait diabetes or diabetes. He fait sick, right? Or j'en ouvre là. So like, you know, those people are susceptible. Like, so is that just the only high-risk group that we should look out for? Is there more to it?
Yes, there's definitely more to it. So I know let they first start tout le monde a dit, oh, si tu fais 60, like 60 years old or higher, you're the one at the most risk because you're older. Okay. I will tell you, I know people who are in their 20s and 30s who have died. Wow. So that is not the exact thing. Yes, if you're older, because your body doesn't work like the last person in their 20s, you are at more risk. But we're actually learning that is not only the case. So we want to use age as one of the big risk factors. If you're over 60, yes, we tend to see that you are at more risk. That does not stop the fact that if you're younger, you can catch the virus. So let's make that clear. Just because you're less than 60 doesn't mean that you can't get it. You can get it and you can actually spread it to everybody else. So let's start there. Okay. Just because you're less than 60 does not mean you can't get a very bad type of it where you end up in the hospital. I know people in their 30s who are on a machine in the ICU right now. So that does play a part into everything as well. Now, if we're talking a minus age, do you have any health issues? Our people have a lot of issues with hypertension and diabetes. They want, you know, they like their carbs, they like their rice. Right. So a lot of us tend to have, by default, hypertension, those things, they play a part because they weaken your immune system. Okay. Remember, in the beginning, I talked about whenever you get sick, your body says, okay, it's time to work. Let me make you better. But when you have hypertension, diabetes, obesity, lung issues, all these other things, your immune system doesn't work as fast. It doesn't work as good. So now when you don't have that good immune system, you don't respond anymore. So now age doesn't even matter because we know we have people who are in their 30s with blood pressure and diabetes, right? So that person just can't even work as good. Think of it as a car. Right? You may have a good car and there may be a new car, but the car has been in car accidents. You don't do an oil change. That car, no matter how old, how the years, like another car who could be older than yours, but you keep up with it. You take it to the auto shop. You take care of it. Same thing with your body. If you have not been taking care of your body, you have all these conditions, even when you don't know it because you don't go to the doctor, your body is at risk now of getting this virus because it cannot fight it even more. Also, people who smoke. I know we don't like to talk about it in our community, but there are plenty of us who smoke. So I'm going to talk about it. Anybody who takes anything for their lungs. So that's not just cigarette, but I'm talking about marijuana. I'm talking about vaping. I'm talking about all cigars. A lot of things that we don't like to talk about in our community. They're taboo, but they exist. So if you do those things, your lungs, which help you breathe, are compromised. This is where the virus tends to start first. So it tends to start an overwhelming reaction and your lungs cannot work the way they should. And what people don't realize is now if your lungs can't work, your heart can't work. If your heart can't work, your kidneys can't work. And that's why a lot of people end up in the ICU in multi-organ system failure, which basically means their whole body is starting to shut down.
Okay. All right. One more question for you, and then we're going to jump to Marline Edmond. So what's the testing process for COVID? And we know that a lot of people have been having trouble, one, getting tested, and two, just what is the test? Like, what do they do?
Yes. So that's the next question that people like to ask is, well, how can I get tested to know that if I've had it or not? Right. So because we're very limited on how many people we can test, we have to screen. So a lot of times they'll give you a phone number or you can call your own doctor and say, hey, I think I have symptoms. The doctor will call you back and say, let's talk about your symptoms. First, starting with where could you have gotten it? Côté où t'es exposé. Est-ce que tu travailles à l'hôpital? Est-ce que c'est taxi? Est-ce que tu joué avec un pile moon or people in New York? Did you take the subway? Were you with a lot of people that exposed you? And that's why I'm concerned. The biggest symptom we're looking for is fever. And not just 199. People are having real high fevers, 101, 102, even 103. Okay. Those are the big questions we like to ask. And the third thing being a cough, because that's one of the few symptoms that we see consistently. You were exposed, you have a fever, and you have a cough. Other symptoms that I want to make sure I mention include some people are reporting you lose taste. This is a very new one, to be honest, because a lot of times when we heard that initially, we thought it was more allergies. And this is, people fait allergie lessa around April, Avril, you get used to that.
Right.
So we did not put that with COVID virus, avec virus corona. But now we're learning it may be a component that avant fin fait fièvre, ou commence ouais, ou pas gen goût dans bouche, and you cannot smell things, ou pas ka prendre sot bagay, ou pas ka prendre goût bagay. That's some things that we've noticed may happen. Can't really guarantee that's a symptom, but that's something that people are talking about. Another big one is gorge fait mal, your sore throat really bothering you, very sore. No matter what you do, pointe, it just really sore. So it's really the whole picture. When you call the doctor first, before you can get tested, you have to give the whole picture. Where could you have gotten it? Where do you work? If it's from work, or if anybody in your family may have given it to you, and what other symptoms you had and how long you've had it is the big thing. Now, because we don't have enough tests, we usually just say, you know what? Fais concours again. Fais concours, you already have it. We may not even test you because we don't have enough. Take 14 days at home, to make sure we can see if it goes away. A lot of times, if it's more severe, like you have breathing issues, you have to go to the hospital, you have to go to the emergency room. That is when we test you. Okay. We also may be concerned and say, let's test you if we know ou pas parler ou pas rencontrer avec un autre monde. Like you have to go to work or obligé à travailler. Like there's nothing you can do about it. So, and you're going to be in contact with a lot of people. So it's very important for us to test you to make sure you don't put other people at risk. And that's another setting where we test you. When you call your doctor should be able to tell you where to go. If it's a hospital or if it's a testing center, they use a swab. I don't know how you call it in Creole.
Bois avec coton.
Bois avec coton. Exactly.
Yeah. Okay.
You'll put on bois avec coton. You'll fouet l'embouchu all the way in the back to get the back of your throat. They also put it in your nose. They have to do both. Okay. And you'll put on bois avec coton. You'll vouer l'un côté and they test it. Unfortunately, what we're having problem because tout moun a testé, li prend pile jour. Gen moun like all the way to day 5, day 7, we're actually getting results, which is why I tell people don't depend on the test. Sous connaît ou gen a lot of those symptoms, ou travaille dans l'hôpital or certain areas ou connaît ou abjoine ni, just fais concours gen. Like act like you have it and try your best not to spread it to other people.
Okay, awesome. Thank you for that. Marline, Edmond, so you are really in health education specialist. So we briefly spoke about, the recommendations from group chats and getting accurate information. How can we get this accurate information to our community? Because there are a lot of information that's being put out there, but it's kind of difficile pour moun pa nou ka comprendre ki sa yo ye, ki more like social distancing. Première fois nous tout attendé ça, and then pour aller expliquer ça by un grand monde. Qui so ap di m'baka l'église, m'baka kaiser, intel, you know what I mean? So it's hard to explain that to them. So where can we get accurate information and information that will stick with our community?
So, premièrement, c'est un plaisir pour parler ensemble avec nous. One thing we have to keep in mind, the social distancing. Un pile moun yo di, m'baka la kay mwen, fòm a travay, fòm pay bil mwen, fòm fè ceci, fòm fè cela. The social distancing, we understand that a lot of our people are essential workers. But one thing that I have to encourage our people, when I say our people, I'm talking about our generation. And the reason why I'm referencing our generation, because we are the generation that helps our parents read their mail, we read their doctor's notes, prescriptions, and things of that nature. It's up to us to encourage our parents and say, hey, this is what you need to do to take these precautions. Chaque matin or chaque soir, moi et les mamans, moi dis, mami qui j'en senti. Matin, when they took your temperature, what was the outcome? check in on your parents daily. A lot of our parents are parents with compromised immune systems. Check on them. Kijon Sansi, did you feel shortness of breath today? I think that's something that we need to instill in our generation and those before us, to speak to our parents, speak to our family members who may have that type of laissez-faire, nonchalant attitude about the coronavirus.
Mm-hmm.
It's very important for us to instill, because we, like Maggie said, they are working in these type of labor jobs that puts them in direct contact and at greater risk of the virus. That's first and foremost. Secondly, nous connaissons tout pas, nous aimons WhatsApp.
Oh, wow. Right.
Like, and my thing is, I love our people for that. Yo, you know, si son bagay ki ba yo importance, yap li, yap cherche, you know, and I get phone calls, I get WhatsApp messages from aunts, family members, people in the community like, Marline, mte we bagay, mte we this, mte we that, mte ya boy up, you know, bon plus information. And the fact that they trust me as not just a health educator, but a health communicator, to break down and demystify the information that they're receiving. With that being said, l'important pour nous-mêmes, once again, to demystify this information. Pour encourager par nous avec ma tante nous, and even our church leaders, pour dire, mettez l'information qui dehors, please, s'il vous plaît. Si information ça pas associée avec un link from a reliable source, si c'est, you know, whether it's Governor Cuomo, si c'est Gouverneur Murphy, or if it's the CDC, or the World Health Organization, if it's not a reliable news outlet, qui ba information, s'il vous plaît. You know,
you can't take it, really.
Do not take it, and respectfully and ask the individual, hey, you know, can you provide me with more information? Ça ka passe, yo gen pile information kap circule sur WhatsApp, les moun, you know, moun pa yo lit bagay yo, et puis yo pay. We saw this in the past with immigration. We've seen this in the past with the migration last year and the year before, for individuals who left the United States and went to Canada. We noticed that the misinformation instills fear in a lot of our people. And we need to make sure that we take that step into educating our parents. We need to take that next step to educating our community, our church leaders, and our church members, and holding these individuals accountable who have that level of respect and that power within the community to provide this information. And you know, if they may not have full information, say, you know, taking the lead and say, you know what, yo gen de toi mom de nan l'église lan ki kon de coronavirus la. On nous présente, not just in front of the church, but in the sense of just like a lot of the churches, they're going viral, they're going virtual. They're going virtual. On nous fait un petit programme pour 5 minutes pour bailler en asthme, right? On nous fait annonce. On nous parle de WhatsApp. On nous parle de YouTube. On nous parle de the different media outlets and let them know this is where you should get your information from. With that being said, there are a few links that I'm going to share in the chat, and I've already shared them. For both New York and New Jersey, I'll be sharing them. The NJ.gov. Governor Murphy, you know, he has his the state of address where he provides updates. Same thing with Governor Cuomo. Governor Cuomo last sent an update earlier today with new updates on ny.gov. So NY for New York.gov if you're living in the state of New York, NJ.gov for the state of New Jersey. Once you go into the website, for example, NewJersey.com, who wants to know NewJersey.gov, who wants to yo gen bagay noir on top of the website qui ba on opportunité pour traduire website là na Creole, right?
Okay, good. Yeah, because a lot of our community needs that in Creole.
So we know we have our parents and our loved ones who have smartphones, right? And they may say, "Oh, but they can go to the website on if you're a New Jersey resident, NJ.gov. On the top right hand side, you will see it say translate. When they press translate, there'll be a drop down, and if they scroll down, not to Creole, but for your choisi Haitian Creole. Parce que nous connaissons, you get 3-4 qualités créole, right? Créole Martinique, Creole Haiti, Creole Guadeloupe, and so on, right? So you want to make sure that they are going to the website and finding that, and then the main website there will be there are a number of panels that you'll see that will say New Jersey coronavirus assistance and services, right? Porque moun ka recevoir information on their where's the closest testing site, which I dropped down in the comments, where they can get the number for the hotline and other information, right? Now, this other information that I'm referring to is not just a testing site, but si on moun pedi trabalho. They have services for unemployment.
Okay.
You su travail, but they cut your hours. If you konya ou manke nan chaque mois, you had your budget. Ou pay kaya on that, ou pay loan on that. But now what they're doing is that they're providing the rental and utility assistance. So they have the different within the portal. There's different panels where people can get further assistance. The last one I also want to share is the updated WIC approved list. People are not thinking much about WIC. I'm like, oh, about no WIC, it doesn't pertain to me. But you have a lot of families who missed out on groceries in the supermarket. Parce que ça t'a passé semaine passée. A lot of people were hoarding food. And then what they were paying attention were the WIC approved items. People were purchasing the WIC approved items. So when your famille qui besoin WIC, maman qui besoin WIC, besoin market pour famille, il pas qu'à acheter parce que the WIC approved items were now sold out.
Right.
When you get en famille qui pas qu'à manger parce que l'autre monde yo a pas acheté WIC approved items. Right? So now you have Governor Murphy, who and a host of other elected officials who provide an hour during the day for your new mothers, pregnant mothers, as well as the elderly and disabled to go to the supermarkets during the midday. Kunya again different population, right? Grand moun qui enceinte, nouveau maman qui ka am nan market bien bonne nan matin. Whether it's from opening to like 11 or opening to 12, in sel moun sa yo ki ka
acheter lesa.
Et puis, le wa acheter nan market lan, ou ka we yo gen tal de bagay yo di yo ka seman pon yon sel gen, or sou acheter manje nan mamit, ou ka seman acheter kat nan sel brand. So if you're buying pois noir, ou ka seman acheter kat. Ou pa ka acheter plus ke kat. So you have the websites that are providing different services for
and then that mette website sa yo la chat la pour nous ka joindre. So pour New Jersey avec pour New York.
So I will send both New Jersey and New York, and then, like I mentioned before, definitely explore the website, and please, again, speaking to our generation, help the elderly, help your parents. Contact that aunt that doesn't drive a car. Contact the church member that you know have assisted in the past. I think what we are failing to do is think about other people during this time, because we're thinking about ourselves. But as we're thinking about ourselves, let's be selfless and assist the vulnerable populations that may not have access and the accessibility to go to the grocery store or even the pharmacy to pick up their medication. That's very, very important.
Yeah, absolutely. Thank you so much for that. But like you said, you're going to put that in the chat. So tout moun ki lan chat lan, sou rete New Jersey ou bien New York, ou ka jwene sa la chat lan ki an ba video. Marline Francois, yes, listen. Mental health son bagay ke communauté nou fait commencer à parler de li. So nous tout lan kay ensemble, nous pas connaît, pour nous habiter ensemble, pour nous parler and things like that, nous can nui lot. Nous gon feel like anxiety. De rete la kay ou pas ka al travail, ou pas ka faire rien, ou just rete la kay. You just lo pour rete la kay. Ou pas ka, for the grand moun yo, ou pas ka l'église. On problème wè c'est y a visité yon an lot, but ou pas ka faire ça too, but communauté a pas comprendre ça for it like how if I just I'll visit moun. So how do we deal with that? How do we communicate that with our
So I guess the first thing I want to say is social distancing, li pa en vacances. Li pa en vacances is not a retreat. And I think Samun Apwe is that, social distancing, when we started it, it happened at a time where the kids were already off for spring break. A lot of schools were off around spring break, the colleges, the kids in high school, elementary school. So some families probably had off work around that time. And now it's like trying to get back into this routine. So kounya tout bagay chanje, gen moun kounya se lakay ap travay, or yo al travay men ti moun yo lakay kounya ti moun yo gen devwa pou yo fe, yo pa kon ki jan pou rede yo avet devwa yo pa kon ki jan pou fe, yo pa kon, I don't know the homework, because it's a lot of, especially the math stuff I hear.
Oh God.
So you're gonna people where my if you please, they're eating your food all day. So you hear a lot of these complaints from parents that they're saying, like, what am I supposed to do with this child or these children that are at home? And everyone's life has changed. It's a lot of adjustment. And I think it's hard for people, especially if you already deal with some sort of anxiety or your stress levels has increased now. And I think the reason why people's stress levels are also increasing because kunya yo lakay, you get up on the Facebook, you're on the WhatsApp, you're on the Instagram. So c'est just nouvelle ap gade chaque moment. So chaque moment we're breaking news. We're breaking news if you di, oh, mais on lot moun moui. Oh, mais on lot 10 moun à l'hôpital. Oh, mais c'est tel in à l'hôpital. So tout ça a fait que wap bat tout temps, la fait tête wap penser tout temps, toute journée wap penser de qui ça qui a passé. So I think it's important for us to find ways to create a schedule, as Fredlin said. You said creating a schedule. So we have to find ways to slow down in the midst of all this. And one of the ways I tell people, dimanche c'est un jour tout est à l'église. So kounya à l'église c'est sur computer or your phone. So while you're home, when church is over, family time is over, start working on your schedule for the week. So, okay. Ou konen sou gen pou chita lakay, pou fè tout travay ou, epi ti moun wap lakay, fè un schedule ki jan wap fè l'école pou ti moun nan. Nou deja konen ti moun pa ka l'école 8 matin jusqu'à 5 du soir. Unless they have a set schedule with their class routine, because some schools, they do have set schedule where at certain times, you have to meet with the teacher in all of your classroom via Zoom. And so that's a way where the students get to connect with some of their other classmates and their teacher. But then you have other students where the teachers are just sending packets at home. And the packets are like hundreds of pages. And that can cause a lot of stress for parents who are not sure what to do. You don't know what to do. So it be now the child is looking at you like, can you help me? And I think one of the other stressors that are coming up too is that some kids don't have a space that is quiet enough for them to do their work. So they may share a bedroom with 1 or 2 siblings, or the house is not quiet enough or not enough space. So like they're on a Zoom call, but yet some of their other peers that are on the Zoom call have a nice background and they're like, oh, your house look nice. And you feel embarrassed to show your screen because you don't know who's going to be running in the background and interrupting you. So it brings on a lot of challenges for people. And for some people, it's hard to adjust to new changes. And I think last week and the week before, we started to see that adjustment where people were like, what am I going to do? I can't do this. And I see someone mention about internet issues. Thank you for dropping the link. That's really good. So in the state of New Jersey, like in Newark, New Jersey, what they decided to do was make sure that every child had internet access and also Chromebooks. They set up hotspots in different areas so that way the students have access to the Chromebook, because we know not everyone has a computer at home. Everyone may not have internet access. So a lot of internet providers are providing 60 to 90 days worth of internet if you have a child at home. Some other services like scholastic.com. We know a lot of books come from there. They're offering a lot of free services. Khan Academy is another great platform. So there's so many educational tools and resources that has opened up free membership. Zoom has opened up free membership for students to be able to learn. So there's so many resources that are available, but I think the problem is our Haitian community aren't aware of the resources. Yo pa konnen. C'est pas faute yo pa konnen. Yo pa gen temps pou konnen parce que y a travail. Y a travail pou mette manger sous table nan. So yo pa gen temps et puis kounya nak mande yo même pour
Fait devoir pour
They did what?
and do all the stuff
They're
online.
like, I didn't go to school to become a teacher.
Right.
I'm working. Mbagay ta professor. Kote professor, where's your teacher? Or now they're probably asking the other, if you have older siblings that are at home, that are home from college, they're probably asking them and saying, well, oh, akunya like I again, but not realizing that child that is at home, well, that adult child you have is at home, is also doing schoolwork, is also doing distance learning, is also struggling with, I'm home now with my family. I can't be on campus and having fun and Timon Sayo, like on the college. Anti-desordre. Which is healthy. It's okay for the anti-desordre. So they're now they have to be back home and they feel like, well, I'm stuck in this house with all these people I don't even like. And that's the other thing you see too. You see people that are in the home with their families and they don't get along with their families, but now you can't avoid them. So how do you navigate all these different changes? How are your sleeping habits? How are your eating habits when you're in the home? Because if you're home all day, you may be snacking all day, not manger tout bagay nou wè ki nan frigidaire nan premier jour nou pote manger au lakay. Et puis kounya li di, oh, ça va manger kounya. Nou pa même grand goût, nou just à nan cuisine ap manger chaque minute. Parce que we have nothing to do, right? There's nothing to do, so it's like, what do? I just eat. But finding it's a matter of finding a schedule that you can create so you can be consistent. So, si nou manger breakfast, lunch, dinner, and 2 snacks in a day, nou bon. Nou pa gen pou an nan cuisine de sac chaque 10 minutes pou an manger ou bagay. Si nou soif, bois un petit l'eau. L'eau li pa déranger ou même. It's actually better for you. So drink your water. It's okay. Yeah. But I think during this time, we have to find ways to lean on each other for support. So some of the things I've been telling people to do is rele grand-mère ou, rele ma tante ou, rele belle-mère ou, rele maman, cousin ou, like, rele moun, epi wè ki jan yo ye. Nou tout gen téléphone, gen moun ki gen FaceTime, yo gen WhatsApp, ou ka rele moun, ou ka fè ou wè jan computer screen na ye kounya, nou tout le katou la, konsa la, nou ka fè sa tout, nou ka create an account on Zoom, ask one of your kids to do it, epi kounya, you, your brothers and your sisters, Zoom on some, not by blog, not pale de sa ki a pase Haiti, you get zen a pase, kone Haitien men zen. So you can do that and you guys have a good time. Or maybe ou ka rele yon na petit ou kone ki pa kon ki jan pou fè soup jumo, like me, soup jumo men pa bon men. So ou ele yo epi wap montre ou ki jan pou fè soup na. So find ways to get creative during this time. Look, I got it, TV shows together, play games together. So use this time to really build relationships with people around you. And I think that's the hard part for a lot of people. Like they don't want to be home. They want to be out and they feel like they're locked up. But you have to find ways to create joy inside of your own home.
Yeah, absolutely.
And if I can chime in here, because I noticed a lot of people are talking about this anxiety that's being created in this environment. And some people have commented. So I think we should probably talk a little bit more about that. From a health perspective, when you're anxious, a lot of times we haven't comprehend how anxiety looks like for us. So let's talk about that first. And Marline, feel free to chime in. People, you'll probably have they have anxiety, but you're essoufflé, like they're breathing really fast. They have no idea. Yo pa ka pense, yal dormi, yo pa ka dormi. Yo met le carbon for like hours. Yo met al dormi at 9 o'clock. Li fait 2 heures du matin, yo poko dormi toujours. Because peut-être you a pensé, and that could be yo pa konnen kote yo pa joindre l'argent, yo pa konnen ki sa yo pa bay timonyo, yo pa konnen, what they're gonna do because their whole life has flipped upside down for almost everybody, right? Yeah. So I think we have to talk about this anxiety and what to do, from a medical standpoint. What I do want to share is there are ways, and we haven't really dipped into this, to control the spread, right? So a lot of times you're anxious because you don't know if sua bailot muni, sua pote la karavel, especially like we talked about, a lot of our family members and people who may be on this chat or people work at the hospital, the bus station, the subway, and things like that. So samwe me di moun is kuive la kay, etire la du gen sou, pa me montre lan kay la vel. Like, because you don't know what germ it has or anything you have. Kuive la kay la, etire la, if sou sot l'hobital la, etire la sa, mette it in a washing machine or super again washing machine at home and you have to go later on. Just to mette it by the door, pour pas même entrer avec soulière, pour pas entrer avec même rag qui sous. That way we can kind of mediate what kind of spread we have. So that's one way to look at it, and as well too. Toujours marcher avec wipes. I know it was very hard to find them at the store. Clean, but try your best to have that with you and have hand sanitizer. So depuis wap ouvre porte pour pas sortir, like a lot of people are going wap passer on ti bagay la mail and have that. Wash your hands, please. Lave mail. Wash your hands and wap lave mail 30 seconds. So, fais ti chanter, pour chanter l'église. I don't know what it is. Whatever. Les personnes veulent chanter, I don't care. Pick something, but while you're washing your hands, sing the whole song with the soap in your hand. Jusqu'à so fini the song. Ou fin ko ala, lo fin ko ala, you wash your hands long enough, and then you rinse your hands out.
And dry them off.
So those are all things that are going to help decrease your anxiety, because you're doing your best to make sure you don't spread it when you leave your work, or you have to go to the supermarket because you have no more food. So you can try to minimize the spread from person to person. So I don't know if you want to share anything else about the anxiety, but I hear a lot of people talking about that.
So oftentimes when I often hear people say, oh, I have depression, I have anxiety, I have stress. So we all will deal with stress. There's something called, some of us will have like acute stressors where it happens where like, okay, you're running late to an appointment. So now your heart's racing, you might be a little stressed, but then once you get to the appointment, your stress levels kind of decrease. So with anxiety, it goes on for a while. So again, when you get anxiety and when you can get panic attack, shortness of breath, that's stuck in your throat. You always say things like, oh, take my food, I just need to leave. I need to leave this. And then it lasts for a short amount of time. And then it goes away. And then you're like, what in the world just happened? So start from a panic attack. If we let panic attack ou pa kon ki lè la privé. Parce gen moun, lè sa kon rive la yo deyo, kounya yo pe pou yo soti deyo, so yo te andan lakay, so kounya yo develop un bagay ke le agoraphobia. Kote yo pe pou yo soti, parce que si yo soti, yo santi yap gen panic attack na pase anko. So moun yo ki get generalized anxiety disorder, sa ton bagay yo gen pou 6 mois. Et puis wet symptoms, ton ko gen shortness of breath, ou toujours à penser, exactly what Dr. Magdala say, where ou pa ka dormi less soir, gen moun ki restless, gen moun ki senti yo irritable, tonkou, their mood is just changing. So ou wè changement.
Yo parle vite, yo aime parle vite too, like what parle they like talk fast. Yo pa ka reti on sel bagay because they're so anxious. Yo parle se sa, yo jump on sa, like they're so, like they just can't process anything happening to them.
Yes. Yeah, and so, so low anxiety, they want to know si yo bezwen medikament pou sa. Pa tout temps bezwen medikament ou kal na therapy. I know someone asked about coping skills. So, epe bagay nou ka fe, nou ka journal. Journal so bagay nou ka fe ki vraiment bon, an pil moun pa fe sa. So, yon na bagay mwen di moun pou fe, la yo santi ton kou yo get anxiety ap leve, pou yo mande tet yo, ki sa ki te pase jou sa? Ki sa ki te pase? Si te pase nan matin, après-midi, le soir, gen moun yo kon gen anxiety, chaque vendredi à 5h. They don't know why. Or yo wè vant yo commence à faire mal chaque dimanche soir. Vant yo a fait mal. Chaque matin pour yo al travail, vant yo a fait mal. Et puis yo wè, gen se travail ne ki bam anxiety. Parce que ça passe en pile, especially pour moun noir, pour moun ki gen immigrant ki pa parle anglais, ou a travail, ou fait c'est ton kou moun ya parle de ou. So kounya ou gen anxiety ou pa vle vle al travay. Ou al travay ou senti ton ou pa senti ou normal la. So ou wap fe mal, tet ou gen tet mal. Up here, you start to have tension in your back too. So I think it's important for people to find ways to take care of themselves. So take baths. I don't hear a lot of people talk about taking baths. People take showers. You'll put shower, you met pour 5 minutes or in you'll put shower in it and then they leave. And then let one up fresh shower too. Lay on a shower and going up run. They're thinking about their day. They're thinking about, I'm getting they're not even sitting there and being mindful in the moment to just smell the soap. How does the water feel on your body? Sou senti de l'eau chaude, de l'eau sil fouette. Sou senti li. Parce que un peu moun pa fè sa, pense toi. So, ça ou bien pour faire, c'est pour just pas penser même during the time.
Try not to.
Yeah, I was saying them. That's it. And then also too, le pour dormir. You have to find a new routine. Sleep hygiene is what I call it. So what I'm fait chaque noir. Chaque soir avant mal dormir. Tant que le soir, ben avec un bagay qui tant que eucalyptus avec mint. So m'pas servi même bagay m'servi le matin pour m'ben. So savon we use le matin, so savon tant que they felt alert. Tant que smells like orange or something fruity. But let's swap when utilize un bagay qui more calm, like lavender, vanilla, chamomile, you know, those kind of things. So that way, at least I feel better at night. Excuse me, I'm coughing.
We
don't know, but I've been home, so it don't matter.
Like you, okay?
Right.
I've been home for 15 days, so we good. I'm not kind of but you have to find ways to find sleep hygiene. So, l'eau ben le soir, ben avec un l'autre bagay le soir. Avant de dormir, ou ka boire entier, on take it decaffeinated. Et puis, là, après, tena, kembe bagay na pour sentir jan chaud. Smell this. Moun pa fè sa, but moi-même, so bagay.
You pa get time, Marline.
No. People do yo pa gen tan, ben moun gen tan pou yo sou WhatsApp, yo gen tan pou yo na Facebook.
Okay.
So, si nou gen tan pou zen, nou gen tan pou tèt pa nou too.
Okay.
So
right. That's good. Okay.
Can I add on to that, please?
Yeah, sure.
Okay.
So we talk about anxiety, but one thing that we have to highlight is the typical busy person, right? Who, like, you know, you have the person who's thinking about the individual who's like, okay, I'm thinking about my bills, but you have the individual who use being busy as a way to cope and avoid. Right? So you have that. I think what's very important that we teach people about the whole stay at home or stay in place, shelter in place, is the importance of rest. Use this time to rest. You work hard, but we need to rest. We need to slow down. You know, we always talk about working, but right? We have to rest. We have to recharge. We have to refuel. You know, we may have some individuals who may not be comfortable with writing, but as someone said in the chat just now, I'm looking at the chat, and you know, a few people talked about walking. One thing that I've learned with my mother is that as a way to get her back into a physical activity, I started walking with her. And sometimes, you know, one thing I've noticed with Haitian, other people love nature. You know, you walk with them in the park. Oh, I'm sorry. Exactly,
right?
Nature brings them back. It's like, you know, like minimum no jardin. Bring them somewhere that uplifts them, and then that reminds them about their past. And you know what I've realized, resting, and when prior to the coronavirus, just taking that time to just sit with an elder and just talking and allowing to you know, quitte yo penser, quitte yo réfléchir de un bagay yo songer, or that makes them happy. That's a major stress relief. It helps them with their anxiety, and it helps them adopt the things that we call self-care. And for us, we journal, we shower, shower with eucalyptus mint and things of that nature. But let's identify what may help our elders and our parents. And but they can create their own self-care practices, but that rest is very, very important. You know, we have individuals who use being busy as a coping mechanism, but encouraging people to rest. It's okay to rest. I don't think our people think it's okay to rest. You know?
Right. Yeah, that's very true. Yeah.
We have to, and you know, Maggie can chime in on this. When we did we had a speaking engagement in East Orange talking about diabetes. We had to pull out the Bible and pull out the verses and say, hey, this is, you know, your body's a temple. You have to treat your body in this manner. But we need to do the same thing about rest. Like, yes, you know, you work hard, but you need to rest. There's so many different scriptures in the Bible that talks about rest. And we do have a lot of parents who are religious. So we have to kind of like connect with them in that manner and just say, hey, listen,
so it's not just me, right? You have the reference to it.
That's how we can empower and motivate them and say, and then, you know, and I've been able to do that in different instances to get my mother and or my father to understand the importance of taking care of themselves. Yeah. So definitely rest is very, very important during this time in terms of like staying inside and maybe, you know, teaching them deep breathing exercise. Like, you know,
yes,
let's deep breathe in. Let's get
Munchie, can you break down, because I think some people are going to have this question, the quarantine versus, from a public health standpoint, quarantine versus self-isolation, because you talk about walking, but then we're talking about them staying home. So I think we may be confusing some people in understanding what it means to quarantine versus isolate versus social distancing. I think we should cover that and separate it for people so we can help our people understand what we need them to do to impact, like not spreading this virus further.
So in terms of social distancing, first of all, social distancing is making sure that you are 6 feet apart from the next person, right?
What's that in Creole? Do we know?
By mon distance. By distance.
Somebody in the comments can let us know how to say that properly in Creole.
You know, I don't know the term for social distancing, but we can use other terms like, you know,
yes.
Yeah. I didn't even notice that.
So sou gade ate a weti boîte faut ta compter même 6 boîtes à terre because each one is like a foot, whatever, a feet. So sou compter they're like 12 inches each boxes, 12 by 12.
6 pieds, somebody says 6 pieds à kon lot moun. So
right. So I would do the boxes. So
yes,
if you go to a store and you're in a store and you see the boxes on them, où est boîte à terre, compter 6 boîtes à terre, on connaît côté au campé, pas quitter moun campé jusqu'à ces 6 boxes. Yeah. So that's one way that I think about it in terms of le malance market, le malance store, so I can know how much to walk by. Walk well on pile market, you'll commence à mettre papier à terre.
Yes, yes.
And they're putting lines.
On va avancer pour aller payer. So on peut acheter, you'll mettre en ligne pour camper là, and the coup camper là, you'll dire ou pas qu'à passer jusqu'à ce que l'autre monde a fini. So once you see that, you can actually get an idea of what that distance looks like.
Yeah. So guys, we're kind of running out of time here a little bit. So I'm gonna Munchie, if you can.
I'll speed it up. So for the most part, although we are in shelter in place, right? So the quarantine is for individuals who may have felt the symptoms, and then, you know, to quarantine themselves for those 14 days, meaning stay in your homes, don't make contact with anyone. Definitely do the procedure in terms of contacting the 1-800 number to notify, and to go online for, if you're in the state of New Jersey, to do a self-assessment test. Follow that. The isolation is, you know, okay, now you know you have the virus and you need to completely be away from everybody, and that includes family. People need to understand that. Même si c'est petit, frère, Mario, at that point you have the virus. Now when I mentioned the walking, although you're inside, you do need vitamin D, you need sunlight, you need air. Now, what I'm saying by taking a walk, you can take a walk around. Uka fait ti marcher dans quartier, but pendant a fait ti marcher, make sure ou pas après moun. Okay, pendant ce temps, même si we are in shelter in place, but you'll get our air and our sunlight gives us the vitamins and minerals that we do need. Yeah. And and it's also for our mental health, which I've dropped a link in the chat about emotional and mental health. And if you need someone sous besoin, on peut parler ensemble avec des santé des mentales pour aider pendant ce temps. So those are the few things that I've shared. I've actually shared all of the links in the chat.
And in regards to the people who has the virus, who couldn't have the virus, mais nous habitons dans la même caille, nous habitons dans le même apartment, ou pas choix. Like, you guys have no choice to separate yourself. One way you can do it is sugyon sham in a living room. Like, let them be in the room. When they're done, somebody go in there, Lysol, spray everything in the other person's room. Because we have to be honest, not everybody may have a way in a house, a big house or something to separate themselves. So if you are in a tight space, you don't have a lot of options. Where suka etieko avec the person, don't use the same utensils, pour manger in the bathroom and things like that to try to create some distance. The likelihood is a lot of times nous tous les deux avons virus left because you guys are so close, but you can try to create that space.
Yeah. Absolutely.
So I wanted to give a resource as far as mental health, because gen moun kunya yo lakay yo senti tonko tet mwen pa bon, tet mwen fou or something, and I don't like to use that word in English because it's such a bad stigma to say. I want people to know that it's all about working on your well-being, your mental health. So gen pil therapist nou ka we. So pil therapist, people like me, nous tout kounya ap fait teletherapy. So teletherapy, c'est jan wè nou gade nou men sou computer nan kounya. Di kon sa, mais se figi pa ou, epi figi therapist na, psychologue, epi yap pale avet ou, you're going back and forth. Yeah. And a lot of times your insurance covers this. So people don't know that. They think that sometimes insurance is only for lawal kay docteur, lawal algare pou gel, dentist, but no, ou ka we on therapist suge insurance. So suge insurance, call your insurance company. Monday you'll see about on list therapist key point insurance. Yeah. Or what you can do is there's websites like therapyforblackgirls.com. So Munchie, if you want to drop that in the comments, because I don't have a comment box. So therapyforblackgirls.com. Low on the website sa, ou ka gade na state wo. Low mete state wo, la mwoto tout therapist na ki na state wo. Epi yo tout noir, tonkou nou. Bel fam Haitian, other nationalities, right? Epi ou ka we ki lang yo pale, ki insurance yo point, epi ou ka voy on message, epi ou di yo, hey, do you have anything available? I'm looking for a therapist. Because kounya nou tout lakay, nou gen tan. Well, pas tout get time, but therapists like get time based off of your time, and you can see the therapist. And sometimes they got free, or it might cost you a copay. Or for some people, they don't take your insurance. Maybe it's more money. But one of the things I want to say is, sou gen travail, un pi travail gen on bagay le EAP. EAP say Employee Assistance Program. So avec EAP couvre anywhere from 2 to 12 therapy sessions for free. This is your job paying for it. So still travail pay EAP na pa même déranger your insurance at all. It's through your insurance, but with your job, it's an EAP program, and you don't have to pay for a certain number of therapy sessions, and you can see a therapist right from while you're at home on the computer screen. So that's something I want you guys to know. It's okay to see a therapist. Pil moun ki vin wè se moun ki na medical field, Moonki educators, people in high school. And I know now is a difficult time for our doctors, our nurses, anyone who works in the healthcare field, our environmental workers, our bus drivers, our taxi drivers. But so yo mem that's on the front lines, that's working in the hospital settings. When that patient dies in that room, it's the environmental service that's going in to clean that room. They're being exposed to because they don't have the proper mask to wear. Yo pa gen gan yo ka changer. So all these people are being affected. Those that have to work in the hospital, yo pa ka mem we familyo. Moun yo ki enceinte, ki pa ka mem gen baby shower. Moun ki, you waited to graduate college. You couldn't wait for your child to graduate college. Kounya entende l'école ne di, you pap gen commencement. They're not doing graduation. Yeah. Right. Now this is your first child. You were waiting to graduate, especially you Haitians. Waiting for the child to graduate. Medical school, law school. I'm going to doctor, avocat, engineer. Et puis, kounya entende, men tel pa bi graduate. Kounya entende, gen ti moun ne pa graduate, même c'est moi qui la paye. But no, c'est pas menti à bail. Toute l'école fermée, kounya, tout bagay fermé. So let tout bagay fermé, li déranger nous tout. So it's okay to see a therapist to talk about this. Yeah. This is why people are coming to therapy, because it's still a loss. Yeah. Oftentimes when we think of grief and loss, we think of people dying. Du papa say grief and loss on koule, travail ou changer, ou pedi job, somebody moves, somebody gets a divorce, somebody has a miscarriage. Yeah. So these are things we need to talk about in our community. We need to talk about fertility. Women that cannot have children, women that are having their babies, but their pregnancy plan has changed because of the virus. So kunya, they were supposed to have the baby next week na l'hôpital na, kunya yo pet, yo pa kon ki jan ya pa na l'hôpital pou soti na l'hôpital na, kunya fami yo pa ka vi na l'hôpital na. Or those, they lost a family. There's a lot of people who lost family because of the virus, but you can't even have a proper funeral or burial. So those are things we need to talk about. So I think now is a time for us to really find ways to connect with each other virtually. Pray for people over the phone. Call them to pray for them. If you have friends that are working in the healthcare field, you have to call them. Call them and see what they need. Get groceries delivered to their house. You can go on Instacart.com, Amazon, and order Amazon Fresh. If you have delivered groceries, so supermarket. Do something nice for those people that are going through all this right now. So, and those that are also construction workers, if you have masks, get masks pour masks and donate them to friends that are in a healthcare setting right now.
Mm-hmm. That's good. That's good. Thank you so much. I couldn't have wrapped it up even better than that. For those who are in the healthcare, moun kap travay l'hôpital, moun kap travay lan nursing home yo, moun kap lan taxi yo, kap mene moun yo al travay lan l'hôpital yo. We thank you guys. We thank you. Nou konnen nan kominote nou, docteur, nurse son gros bagay, right? So pile nan moun ki lan l'hôpital yo, se Haitien yo, right? Gen lot nation too, but se Haitien yo, right? So nous thank nous remercier nous pour ça n'a fait pour n'a aider tout le monde nous connaît que nous perd tout nous gen famille par nous qui ka affecté avec virus corona but nous do merci pour tout ça à faire and we're holding you guys in our hearts and our thoughts and in our prayers. We put a lot of the information in the chat. Nous mettons pile d'informations dans le chat là. Also n'a continuer mettre information sur Haitian Times on Instagram, on Facebook, on Twitter, and on LinkedIn. So, you can follow nous on toutes platforms, the Haitian Times. And so, on our website, thehaitiantimes.com, nous avons une section specifically for coronavirus. So, libre information, non seulement information ici, New Jersey, Florida, New York, a lot of New York, but nous avons information de moun ki Haiti aussi. So, si vous avez famille en Haïti ou si vous avez besoin de ce qui passe en Haïti, ou ka HaitianTimes.com pour joindre toute information. So, thank you guys. Marline Marline Francois-Madden. Thank you, Dr. Magdala Chery. We thank you guys so much. Thank you guys, everybody who joined on the chat. We appreciate you.
Thank you.
Thank you.
You guys have a great night and good night. Bye,
Thank
everyone.
you.
Bye.